Through this series of videos, we will be demonstrating and discussing airway management and oxygen. First, I will review some therapeutic techniques prior to ordered therapies. The first technique we will be discussing is called diaphragmatic breathing. This is an easy technique you can teach to any patient that they can use anywhere, in the hospital, the grocery store, whatever. So what it is, you first start off sitting up. You want to squeeze the base of your ribs. This is to prevent you from breathing with your stomach and to promote breathing with your lungs. What you want to do is inhale for 3 seconds, hold for 2 to 3 seconds, and then exhale for 7. After practicing this technique for at least 5 times, you want to instruct your patient to deep cough. This is to release any kind of secretions, any kind of sputum they have lodged in their airway to prevent oxygenation. You want to release that so they can cough it up. The next technique we will be discussing is called pursed lip breathing. So what you want to do is instruct your patient to inhale for 3 seconds, and you want them to position their lips as if they're blowing out through a straw. Through this, you exhale for 7 seconds. And you want them to repeat this for about 5 to 7 times, and this is to promote, exercising your lung muscles, to releasing secretions, and after that 5 to 7 exercises, you want them to deep cough. The next technique we'll be discussing is called orthopnic breathing. This is a more advanced adaptation of your high Fowler's. So what you want to do is have your patient sitting at the edge of the bed or sitting up in their bed if they're immobile. You want to position their bedside table, chest height, apply a pillow to provide some kind of comfort, and have them lean over, pushing the bedside table up against their chest. This is to relax any patients who's going through any dyspnea or labored breathing. The same deal, they need to inhale for 3 seconds, exhale for 7, and cough within 5 to 7 exercises. This is to release the secretions, strengthen their lung capacity, and get their oxygenation back to where they need it to be. The last technique we will be discussing is your incentive spirometer. This device is used to exercise your lung muscles, including your diaphragm, as well as keeping your lungs healthy and increasing your lung capacity. Starting off, you want to make sure the mouthpiece of your incentive spirometer is clean. It can be removed and to be washed with warm water and soap. All right, you want your patient sitting up or at a high Fowler's position. Instruct them to exhale as much as they can. Firmly place the lips on the mouthpiece and inhale into the tube. The goal is either to set a target for them to inhale, keep the device within that target, and to hold it at that target, then exhale, repeat the process. Or another technique is used to just keep it as high as possible, as long as possible. Again, this is to increase lung capacity. It's really good for your asthma patients, your COPD patients, anyone who's having trouble breathing. With this device, you need to instruct your patients to try the breathing technique at least 10 times every hour until they feel they can get a full breath, inhale and exhale, or to get their O2 saturation back within its normal range. A helpful tip to remember is you may encounter patients who's on oxygen therapy that may need to be transported throughout the facility. Make sure that you have adequate oxygen for transport.
Today we will be talking about oxygen management. Before starting any type of oxygen therapy, you need to know your patient's oxygen saturation. Here are 2 types of monitoring devices for gaining that. This wraps around the finger and it can be a continuous oxygen saturation monitor, while this is usually attached to the vitals machine and can be used to gain an intermittent oxygen saturation. There are different types of devices that can be used to administer oxygen. The most common is going to be your nasal cannula. It is recommended to be used for flow rates of 1 to 6 liters per minute. Then you have your simple face mask. It should be set at a minimum of 5 liters per minute recommended to push the carbon dioxide through the holes that's being breathed out. You have a non-rebreather mask. which provides 95 to 100% oxygen concentration and recommended to be set at 10 to 15 liters per minute. And then you have your Venturi mask. It provides 25 to 50% oxygen concentration and can vary between 4 to 10 liters per minute based on the attachment used. And you see these a lot with COPD patients. Hi, Mr. Edgar. How are you today? My name is Colleen, and I am going to be checking your oxygen saturation because your doctor has ordered some oxygen therapy. Can you tell me your name and date of birth? Okay, thank you. We'll get some gloves on. Okay. Let me just borrow a finger from you. I'm just going to check it before I start the oxygen therapy. Okay. So in starting oxygen therapy on a patient, you want to make sure that you have your new nasal cannula and that you have your oxygen flow meter set up. Most hospitals, this is already in the room, but if not, you would need to gather this as part of your supplies and plug it into the oxygen marked or green plug. I'm going to open your nasal cannula. Some providers will order humidified oxygen. Per facility policy, you would either gather the fluid container and fill it up, or you would gather a new saline bottle. That just attaches right up underneath here with the tubing attached to the other opening. So you want to make sure that we open our nasal cannula. Attach the tubing to the flow meter. Make sure there's no kinks in the tubing. Set the flow meter to the prescribed amount of oxygen, and make sure you can feel oxygen flowing throughout the delivery device. So in this case, the nasal cannula. You'll then attach this. So the nasal cannula, the curves go towards his nose. You bring it gently around his ears. Secure this so it's not too tight, but that way it can't wiggle around. You can pad behind the ears and the cheekbones as needed for comfort and to avoid skin breakdown. Okay, does that feel better, Mr. Edgar? Does the device feel okay on your face? Okay. So I will be back to check on you in a few minutes to check your oxygen saturation on your finger again. Your call bell is here. Your bed is low and locked. And if you need anything before I come back, just call, okay?
Good morning, Mr. Edgar. My name is Nola, and I'll be your nurse today. I understand that you're having some problems breathing, and you have some secretions, so I'm here to suction those out just to help you breathe better. Can you state your name and date of birth? Okay, thank you. And for a patient who needed to be suctioned that was unconscious, you would lay them down in a lateral position, side lying, and that position just helps them so they don't aspirate, basically. But since he is conscious, he is sitting in a semi-phalanx position, and I will turn his head sideways to the side, either side, it doesn't matter, and position a towel under, just so we don't miss his sheets up in his gown. And then I would turn my machine on to the lowest, right? And then you would increase as needed. I'm going to put my gloves on before I start. And it can be noisy, so you would explain to the patient if this is their first time that it's noisy, but it's just to help you. And I'm just pouring saline, or you can use water because it's not a sterile procedure, into this basin, because I'm going to check to see if the suctioning is proper before I start suctioning his mouth. And I would open a new yonker and attach it. And it's suctioning correctly, so I would start suctioning. And I'm going to insert it into the sides of his mouth and go in 4 to 6 inches. And I would not start suctioning until I insert the yonker. There's the other side. And the patient may gag, but if he's gagging, just release your yonker some, because he doesn't need to vomit. And then I would dispose of the yonker or keep it per facility policy. And then I would check his O2 saturation, his breath sounds, and I would ask him, is he okay? Are you feeling okay, Mr. Edgar? And if he's breathing better, I would let him know that I was coming back to check on him later. And I would position him comfortably. And make sure the wheels are locked, the bed is in the lowest position, he's comfortable. Wash my hands.
Hi, Mr. Edgar. How are you today? I'm Colleen. I'm going to be your nurse today, and I'm going to be helping you with some oral care. Can you tell me your name and date of birth? Okay, thank you. Oral care for all patients is important because you want to make sure that they feel comfortable and that you're keeping the bacteria to a minimum. But especially for oxygen patients on oxygen, or that have an alteration in airway, because their airway can get extremely dried out. Their mucous membranes can be dried out by the oxygen and by changes in their airway. So we want to make sure that we're not fostering a breeding ground for bacteria or causing ulcerations in their mouth. So for Mr. Edgar is conscious. So for a conscious patient, for oral care, I have a basin, an emesis basin, a toothpaste, toothbrush, a water-soluble moisturizer, some water and a cup of water and a towel. I also have suction set up just in case with a new yonker. So I'm going to put my gloves on. Mr. Edgar does not have dentures, but if he did have dentures, we'd have to take them out and provide denture care and then do oral care with swabs. So I'm going to place this towel down to protect his clothes. Mr. Edgar, can you hold this for me for right now? Thank you. All right, so I've got some water in a cup. If you just want to moisten your mouth for me, and then spit. Okay. I'm going to apply my toothpaste to my toothbrush. Moisten it a little bit. Okay, then I'm just going to gently brush on all sides of his teeth. Making sure to get the tongue, and that he's sitting up in a high enough position so that nothing will go down his throat, even though he is conscious. Okay. There you go. You can rinse a little bit for me and spit. Thank you. Okay. I've got some lubricant here I'm just going to use to moisten your lips and your nares as well. Is there any anything else I can do for you today, Mr. Edgar? All right. Well, your call button is right here. Your bed is low and locked, and I'll be back to check on you in a little bit, okay? In this case, this patient is unconscious. We would still greet the patient. All right, Mr. Edgar, I'm going to be providing some mouth care for you, okay? I would have another nurse to verify the name and date of birth of Mr. Edgar and still provide for privacy. For Mr. Edgar and all patients, it's important to assess their ability to swallow before sticking anything in their mouth or providing oral care. This particular patient, like I said, is unconscious. He does not have voluntary control over swallowing, so we're going to make sure that his bed is flat and we turn his head to the side. For this skill, I have the same as the previous. I've got the towel, the emesis basin, the water basin, toothbrush, toothpaste, cup, and water. I've also added a syringe and the glycerin swabs. Again, I still have suction set up. And first, I'm going to cover him and place it on his pillow. I'm going to tuck the emesis basin up underneath his chin. By turning the head to the side, it allows for gravity to pull the secretions out of his mouth instead of down his throat. But I'm also going to inspect his mouth to see if there's any reservoirs of water or anything tucked in his mouth that would require suction prior to brushing. Mr. Edgar is good. So I'm going to do the same procedure, except I'm going to take 10 milliliters of water and moisten his mouth, having suction available just in case. Okay, it's all draining out. Now I'm going to moisten my toothbrush, apply toothpaste, and I'm going to carefully brush his natural teeth. Again, if he had dentures, we would have pulled the dentures out using a piece of gauze and provided denture care. So I'm going to rinse again. Because he is unconscious, they sometimes have a problem with keeping their mucous membranes moist more so than a conscious patient. So we're going to use glycerin swabs. So I'm going to take one swab and do his left cheek. Get a new swab, do his right cheek and the reservoir between his teeth and his lips. A new swab, do the roof of his mouth and his tongue.
You rinse the patient's mouth with this one.
And now I'm going to rinse one more time. Ensure all that is draining out. Suction anything that's left. Okay. Wipe them up. And apply our water-soluble lubricant to moisten the lips and the mucous membranes in the nares as needed. Then we will return him to the position that he was in. Making sure that we leave him comfortable. The bed is not cooperating right now, but we would ensure that the bed is low and locked. We would ensure the bed is low and locked, that he has a call button available to him, and that we take our gloves off, wash our hands, and come back and check on him.
Recently we talked about oral care for an unconscious patient. In this video we're going to talk about additional care techniques needed for an intubated patient. You're going to need an oral care kit. In that care kit you will find a pre-packaged green swab. You're going to take that swab, apply it to suction if available, and gently swab the mouth until clean. You need to do this every 2 hours in order to prevent ventilator-associated pneumonia and other bacteria. Also, you will want to use a moisturizing lip balm to moisten the lips, and also clean the endotracheal tube as well. Hey Mr. Edgar, my name's Taylor and I'm going to be providing safe suction today. Do you have any questions? Can you tell me your name and date of birth? Okay, and I'm going to have you in the semi-Fowler or Fowler's position. Okay, and also, if your patient is not breathing spontaneously, you will need to pre-oxygenate with the bag for 1 full minute. Okay? And also, during the process of suctioning, you want to monitor your patient's pulse ox to make sure their oxygen's good, so you want to monitor that throughout the process. Okay, next, I'm going to protect my patient's clothing. And also, throughout the procedure, you may want to wear a gown, goggles, or mask. Especially a mask is what I'm going to wear in this video to protect the patient from infection. Now I'm going to pour my saline into my basin. And now I will apply my mask. And now I will apply my sterile gloves. Now that I have my sterile gloves on, I'm going to start the process. So with my dominant hand, I'm going to take my suction catheter, as it is sterile, and I'm going to hook it up to my suction with my non-dominant hand. You want to go ahead and turn on the suction to exceeding no greater than 120. You want to take in a couple milliliters of normal saline just to flush it and make sure everything's correctly. There's no kinks, there's no leaks. Now you want to cut your suction off. You want to lube your suction catheter. Next, we're going to insert our suction catheter until we meet resistance or the patient coughs. Now we're going to turn on our suction. And you want to suction at a 10-second interval, no greater than 10 seconds. Now you want to cut your suction off. Okay. So as you're withdrawing your catheter, you want to be pulling it out over your 10-second interval. And now you will take your catheter away from the port. And you will clean up your sterile field. And you also want to recheck your patient's oxygen as you've been monitoring throughout the procedure and make sure everything's good. Okay, Mr. Edgar, do you have any questions? Are you feeling okay? I'll be back in to reassess you, okay? You want to make sure your bed rails are up, you want to make sure your bed's in the lowest position, and wash my hands.
This is Carter, and I'm going to be demonstrating tracheotomy care. Good morning, Mr. Eggert. My name is Herbeline, and I'm going to be doing tracheotomy care on you today. I'm going to identify you with 2 identifiers, and I have another nurse here with me who's going to identify your date of birth. So I would identify him with another nurse since he cannot talk. So tracheotomy care is where I go in and clean your tracheotomy. I'm going to clean around it. I'm going to clean your cannula. I'm also going to change your ties. Okay? Is that all right with you? Okay, so he nodded his head for verbal consent. At this time, I'm going to make sure I have an arbitrator in my drawer and a smaller size tracheotomy set. I'm going to wash my hands and provide privacy. I'm going to bring all of my supplies in my room. I've got all of the supplies that I need. What I'm going to need for this procedure is some clean gloves, a mask, sterile gown, normal saline, sterile gloves. I'll need a barrier to cover him with, and a tracheotomy kit. I'll start out by raising the head of the bed up. I'm going to listen to my patient's lungs to make sure that he has adequate breathing. I'm also going to check my pulse ox that he has on right here, and it's 95% at this time, so his oxygenation is well. I'm going to set my table up. I now have my table set up. I have my sterile gown on, my clean gloves, my mask, and I'm going to take my peroxide. I'm going to pour it here, 1 inch, and then I'm going to take my normal saline, and this is a new bottle, so I would date it. It's good for 24 hours. I would pour 1 inch in here, and then I would pour some in both of these containers here. I'm going to put a barrier over my patient. I'll take off the oxygen here. I'm going to take off the dirty. And at this point, I will take out the cannula. Now, the cannula that he has is a snap. You're going to hold the clamps, pull them. You're going to kind of pull it to an angle. And you can take it and you're going to put it in the solution. Now, there are some cannulas that you will turn counterclockwise, okay? So at this point, I will take off my dirty gloves. I'm going to put on my sterile gloves now. The rest of this needs to be sterile. I have my sterile gloves on now. So at this point, I just want to set up my table. Remember not to reach over my sterile film. My sterile area now is ready. I'm ready to clean my cannula. So I'm taking the brush . You're going to keep it clean that. Clean this side of your area. I'm going to put it in now, just the saline solution to soak, get rid of the peroxide off that. Mr. Eggert, you doing good? Okay. Now I'll take mine, I'll dry this. And you want to take the pipette or the pipe, and you're going to dry it. Now you're ready to reinsert your cannula, and to do this you're going to insert it kind of at a 6 o'clock position. It just goes straight in. You want to clamp that, make sure you hear the click. There you go. Before you make sure. So our cannula is now in, so we're going to clean the stoma. Come up here behind it. Discard these. Clean around this area also. So now I'm ready to place my new ties. Important to know that do not take off your old ties until you have the new ties on. If you do this and your patient coughs, then your cannula may be expelled. Start on this side, and you're going to feed this through here just like this. Okay, can you pause it? So I'm inserting my ties right here. Now there are some facilities that do have the Velcro ties. That does make it a lot easier. But if you have this type of tie, you'll need to make a knot with it. Okay? So what we want to do is take these ties, bring them around the back of the neck here. And you bring both ties around, okay? Here's my ties. And I want to feed this through here. I'm going to come over here, tie this to the side. I'm going to do a double knot on this. Secure this in place. Once you get your knot in, you want to check. Once you get your knot in, you're going to check to make sure you can get 2 fingers under here. Now you're ready to remove your old ties. Take off the old tie. Okay. Once again, this ensures that your patient does not lose the cannula. Okay. Now that we have the ties secure, And I can get 2 fingers under here. I will place my dressing. Okay, Mr. Eggert, we're almost done here. There we are. There's that one right there. Yep. Let's give you your oxygen back. I'm going to listen to his lungs. I'm going to look at his oxygenation level. 99%. That looks good. Mr. Eggert, I'm going to leave your call light right here with you. I'm going to lower your bed, put your side rail up. I'm going to put your head back just a little bit. Low lock position. The patient has the call light. I'll discard all of my materials. Take off my gloves. Mr. Eggert, is there anything else I can do for you? Okay, I will be back to check on you just shortly. Thank you for letting me do your trach care. Mr. Eggert, thank you for letting me do your tracheotomy care. I've washed my hands and I'll go document my procedure now.